this was on risk score, the new risk score. So I should start because I have only 10 minutes. So I will present some of the data. As we all know that Muslims around the world, around millions of Muslims are with diabetes and they want to fast during Ramadan. And to manage these patients and to address their problems during Ramadan, we have to see them before Ramadan. That is very important. And then we usually tell them to come before Ramadan, at least 6 to 8 weeks before Ramadan, to get a pre-Ramadan assessment. And this pre-Ramadan assessment is, of course, is very important to know the risk of our patients. And for risk stratification, we need a detailed medical history, the aspects of diabetes and ability to self-manage their diabetes, the presence of comorbidities, their past experience of fasting, and their ability to manage their diabetes. And of course, we have to look into certain other factors. This all should be done before Ramadan. And these risk scores and risk categories are for that purpose, that can help us during this assessment period. So we had it in 2016, our guidelines have risk categories, as our previous speakers have alluded to it, and I'm not going into detail of that categories. The newer risk score, which was given in the previous, the last year, newer guidelines 2021, this we are talking about this risk score. We have listened to all of our worthy speakers in the previous lectures about this risk score. I'm not going into that in detail. So I'm coming straight away to my study. This was the study which was designed to validate the clinic, to see validity of this risk score in our patients who are coming before Ramadan for pre-Ramadan assessment. This study was done at Bakai Institute of Diabetology and Endocrinology, and it was a prospective observational study. The ethical consideration was taken from Institutional Review Board, and the study duration was between March and May 2021. The sample size was 258 patients. People with diabetes who have intention to fast during Ramadan, they were seen before Ramadan, 1 month before Ramadan. And those people who are extremely ill or they don't want to fast were excluded from the study. Minor hypoglycemia was defined as RBS of less than 70 milligram per deciliter. Major hypoglycemia was defined as a blood sugar of less than 40 or equal to it. Minor hyperglycemia was defined as more than or equals to 200 milligrams per deciliter, and major hyperglycemia was defined as more than or equals to 300 milligrams per deciliter, including diabetic ketoacidosis and hyperglycemic hypersmolar state. So pre-Ramadan assessment, the structured education was given to all of the patients, the informed consent was taken, demographic data was recorded, and the risk score, according to the new risk score calculator, we calculated the risk of each individual. And during the post-Ramadan visit, soon after Ramadan, within 6 weeks after Ramadan, the fasting status of our patient was inquired and assessment of complications was made. And statistical analysis was done using SPSS version 20. So there were a total number of 258 patients, and they were categorized according to the risk score. 62.8% were at low risk of fasting, according to the risk score. 78% or 30% of the population were at moderate risk, and 7% of the patients were at high risk. This is about the fasting status of of people who fasted during Ramadan, it showed that from the low risk category, 96.9% of the patients fasted during Ramadan, while in moderate category or moderate risk score, there were 89.7% who fasted during Ramadan. From high risk category, 77% fasted during Ramadan. The number of days fasted were 90% of them fasted for the whole month in low risk category, while 80% fasted in the moderate risk category and 77% fasted in the high risk category. This is the data from 241 patients.